And so about NAID, we were established on January 16, 2025, based on real lived experience. We are a 501c3 nonprofit, and we're the first independent national nonprofit entity of its kind to bring together various stakeholders and entities together. I'll go over a little bit more about that in the next slide, but also research, education, and advocacy is central to our mission as an organization. Oops, sorry. Actually, that's a few slides down more. But our mission is to support and empower individuals, healthcare professionals, and decision makers through research, education, and advocacy initiatives to eliminate health disparities and to advance equity in all communities. Our core values are equity, empowerment, and resilience. We believe that everyone that's a part of our organization should embody one or more of those core values. Okay, I don't know why it's cut off, but basically there is a place for everyone in our organization. And when I mean that we're an organization that brings together various stakeholders, you see we have memberships for patients, for patient navigators, for clinicians, for practitioners, for corporate entities, community leaders, researchers, policy experts, students, academic institutions, fellows, and nurses. Those are cut off, sorry about that. This is my mantra, and this is a quote that I've come up with and that I just believe. In order to sort of end health disparities and advance health equity, it requires a collaborative approach. And that collaborative approach is NAID, the National Alliance on Ending Health Disparities. Oh, goodness. Okay, so NAID exists because of my wonderful sister, Bryant Harvin, and she's actually here today. Her journey exposed the cracks in the healthcare system, and I wanted to build that accountable response for her, just based on her lived experience. So, about my sister Donna, she's not only all these things on the screen, she's a sister, a wife, a daughter, a dog mom, rare disease patient, a chronic condition patient. She's also a board member of NAID, and she sits on our board as the strategic director of patient services in rare disease equity. But most importantly, she is someone with that lived experience. And that's our cute dog, Teddy, and my dog, Niece. So, where did Donna's medical discrimination come up? It came up in provider care, and it also came up with insurance providers. I can talk a little bit about that, but what I've seen with being one of Donna's caregivers is that she was pushed out of care by providers. She wasn't listened to, and her lived experience wasn't taken as seriously. I've also had to see her battle insurance companies for her conditions and pre-authorizations just to live somewhat comfortably and be somewhat pain-free. And that's just heartbreaking that you have to explain to an insurance company that you basically just don't want to be in pain and that you have to justify it through prior authorization. It's no way to live. I also recently discovered that I'm a rare disease patient too. So we'll talk about that a little bit. And the next slide. So I have two conditions. One is called keratoconus, and that condition is a condition where I basically can't see far away, so it's called nearsightedness, and it just gets progressively worse. There's no cure for keratoconus, there's only treatments. And so right now, there are a few different options. So you can do what's called a corneal cross-linking, which is something where you have to go under a UV light and have these drops sort of inserted in your eye every 30 seconds. And I had to battle insurance companies for that treatment. So I got it done to one eye, still need to do it to the other one. And this other condition is called dissected cellulitis of the scalp. And so basically that means my body, on my scalp, my body is sort of reacting, or my immune system is reacting in a defense mode, and it's sort of attacking my scalp and sort of creating like lesions and things of that nature. Basically infecting itself. It's kind of chronic, so it goes, it comes, it goes, it comes. It's not really a cure for this type of condition. And so those are two conditions that sort of, made me a rare disease patient that I'm kind of just now realizing. Where did my medical discrimination show up? It showed up in my care settings, and it also showed up with my insurance provider. In my care settings, in particular with my dissecting cellulitis of the scalp, I've been to 4 different dermatologists. I've been misdiagnosed 3 different times out of those 4 times. I was told it was something different each and every time, and then on top of that, the dermatologist I used to see before my current dermatologist, actually, when I asked for a different approach to see if we can get this condition more under control, her exact words was, absolutely not. Why would you tell a patient absolutely not when they're informed about their care? It just felt very dismissive, and honestly, it did hurt my feelings because I'm someone who tries to take the initiative in their own healthcare and make sure that I'm asking for, evidence-based care to support me long-term. And just to get that with no explanation, I felt was very dismissive. Backing up to the insurance provider, so with my condition keratoconus, that was really difficult to sort of navigate because you have to get these codes from your provider, give them back to the insurance company, and then they decide if they want to pay for it, which is, a prior authorization. So that was really frustrating to have to deal with, and with keratoconus, really insurance companies, there's an option that can sort of restore some of your vision, but they call it, which is called an epi-on cross-linking, where they perform it with the lithium still on the eye. They consider it experimental, and therefore that's not covered. They only cover the epi-off with the prior off. And so, it's really upsetting because when you think about it, when the epi-off procedure kind of demonstrates that it brings back a little lost vision, and you have these insurance companies saying that it's experimental. Well, I didn't know that saving my eyesight was considered experimental. So it seems like they only will intervene when you need a cornea transplant, which will cost even more money, more pain, and more recovery time. I just kind of thought it was ridiculous. But as you can see, just in Donna's story and my story, you can see some of the common themes come up in care settings and with insurance providers. And something just has to change. So I will tell you, these are all words that rare disease or even chronic disease patients have felt. Pain, dismissed, exhausted, confused, misunderstood, alone, unseen, angry, but yet we're always resilient. And my last thoughts that I want to leave with you all, your lived experience is expertise, period. Don't let anyone tell you the pain that you're feeling or that it doesn't matter. And I will leave you all with that. Thank you so much.